Good morning, it's Dr. Anna. How did I find myself in the role of physician-patient advocacy? Well, it's something that happened to me during COVID that is deeply personal. I had a family member who was struggling, and in 2021, we turned to the hospital for a little bit of support. And I thought that perhaps he would be guided to a therapist or someone that could really help him with his mental health and to process some of his traumas. Instead, all that happened was my family member was locked into the hospital against his will for a month and force drugged and released from the hospital 40 pounds heavier on depot injections of long-acting Abilify Maintainer, which is a type of antipsychotic medication. Sight unseen, he was force injected every month with this drug, and he was behaving erratically and compulsively and definitely out of character. Went on to punch a window, and that put him under the Mental Health Act for another year of forced depot injections of Abilify Maintainer. This is a drug that has over 3,000 class action lawsuits under Bristol-Myers Squibb. It has FDA warnings about compulsive behavior, hypersexuality, compulsive gambling, compulsive drinking, using of drugs, any underlying addiction, food, whatever, that's what this drug will elicit. These are well-known facts, and yet this province injected well over 4,400 people in 2023 with this drug, and the excuse was that we're so overwhelmed or because it's Health Canada approved. I've had many meetings with Health Canada wondering how this drug got approved, considering that the phase 3 trials were done on 10-year-old children. It seems highly unethical to me. Nobody can give me answers or take any responsibility for how this process happened. The same lobbyist pushed for depot antipsychotic injections, also pushes for depot opioid substitution therapy for drug addiction, where people are force injected different medications. It benefits drug companies such as Otsuka, Indivior, and Janssen. It certainly doesn't benefit the patient. It just creates dependence and lifelong customers. And so because of my personal experience, because of the pain that it caused myself, my family, and of course my loved one, I decided to speak up, and I was flooded. My mailbox in the office was flooded with patient stories, and so many people have gone through this. And unfortunately in this province, because of this very outdated piece of legislation called the Mental Health Act, which allows for a patient to be admitted, even a nurse can decide that the patient is not able to look after themselves, and put them under the Mental Health Act and then force them into treatments where they have no say, no choice, and no one can advocate for them. It's profoundly disturbing. And these are not medications that are to be taken lightly, because once they're in the system, they have a half-life of 50 days. So they're in the system for months. So they have lethal drug interactions. They have lots of different side effects. First Nations populations and Asians populations can't metabolize them. And we have now nurses working for the drug industry, diagnosing, injecting, and prescribing from Island Health designated pharmacies. So yesterday, David Eby has said that he is expanding involuntary treatment. Well, what does that mean? We don't have the infrastructure, we don't have the manpower. So all that's going to mean is that patients in the community will be injected with different pharmaceuticals for their mental health struggles or their addiction. And this does not benefit the patient. This only benefits the drug companies. And we even have outsourced contracts to Alio Health Home Care, where caseworkers can go to people's homes and do wellness checks with police and inject people with different long-acting medications without recognizing the possible side effects. And one of these is akathisia. Akathisia is this compulsive urge to move and this inner restlessness that can lead to very compulsive behaviors, like driving a car through the Lapu Lapu Festival, or jumping off of a balcony. And the BC coroner doesn't seem to be linking these profound medications that are implanted months prior to what is happening now. And my question is, who is receiving all the pharma kickbacks, all the usual honorariums from Otsuka, Janssen, and Indivior, and the drug companies in order to continue this type of practice? And Island Health also had people enrolled in for-profit pharma marketing funded drug trials, again, with absolutely no informed consent. And this is very similar to the Dan Markinson case, where a young man killed himself on a Seroquel drug trial, and the mother fought for him, but of course, these drugs were forced. And so we have a huge system problem of outdated, coercive mental health legislation, forced treatments, massive pharma profits where the health authority is receiving kickbacks, and pharmacies are in on it, designated pharmacies, and are also benefiting from this. And it's costing the taxpayer quite a lot of money because the drugs themselves are very expensive. A drug alone might be close to $10,000 a year. That's taxpayer funded. And the long-term outcomes aren't so great. And so for patients that have no choice, no voice, and cannot decide what type of treatment they want, and there's no exit ramp, no way to get off of these drugs, we have a massive system failure. And I don't really know where else to take this. I've taken it to the police, and the police say, well, you know, psychopharmacology is not in the scope of our practice. The RCMP will tell me that this issue is way above our pay grade. Health Canada can't tell me how these drugs got approved in the first place. And the health authority has lawyers on retainer within the entire province. So patients really don't stand a chance. And if you go to Facebook and read the site called Pathetic Excuse for Support, you will see the struggles that patients in this province have had with the Royal Jubilee Hospital, with psychiatric emergency services. And if I report individual doctors to the College of Physicians and Surgeons, I am told that I shouldn't be disparaging my colleagues and that that is highly unethical, and they want the patients to report individual psychiatrists. Well, most of the patients don't know the system and don't know where to turn. They don't know that you have to go through QA, through Patient Care Quality Office, then the college. And so patients don't really stand a chance in this system. They can be very iatrogenically hurt, labeled, discredited, threatened, and nobody acts on their behalf. And so in conclusion, I realize that if you do stand up for patient safety, you will be silenced, discredited, threatened, fired, and they will come at you from all angles. From the Doctors of BC, they'll come at you from the Health Authority, from University of British Columbia, from the college, and of course nonprofits such as BC Schizophrenia Society will hit hard with legal threats. And it becomes very clear that there must be staggering amounts of pharmaceutical money involved in order to not be addressing this. We have a terrible drug addiction crisis in British Columbia. Youth are struggling with their mental health, and more drugs, more pharmaceuticals, forced treatments will not address this issue. This is a political issue, and I am not sure which political party understands even where to start. But I have a few suggestions, and I often talk to reformed drug addicts, and it appears to me that a lot of this is choice, but patients need to be involved in their care, and they need to have a voice and choice.